Well, welcome back, everybody. Good to see you. Hope everybody's enjoyed their day. So we are honored to have our CEO, Safra Catz, with us today, and so please join me in welcoming her to the stage. We spent this morning talking about transformation, right? So a lot of conversation about transformation in healthcare. But you've been at Oracle for over 25 years. Tell us about the transformation that you led inside Oracle.
Well, it's really quite funny because every time I talk to one of you, I end up thinking that so many of the things you're going through are exactly what I went through. Not in medicine, but when Larry first hired me, he said one thing. He said, "We are the largest data management company in the world, and our only actual assets are our people. And at any one time, I have no idea how many I have." And I thought, oh, come on. How hard can this be? And he explained to me that the way Oracle had grown over the years, started in the United States, then the UK, other parts of Europe, Asia, the Middle East, everything, that every single place we thought we were global, but we were actually international, which meant that we were in all these different places. And even though every line of business in every country used Oracle software, they changed it a little in every single place. So we were a giant stovepipe data here, 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 here. And you couldn't just do, as some of you technical folks know, you couldn't just do a giant query and then a join and then dedupe it, because everyone had a different process. And in many of those systems, there were so many duplications that you literally had no idea. The simplest thing in the world, which is how many people work here. Now, that's a simple problem. But in every one of those lines of business, in every country, we also had our own financial systems. So when we would bring those back, once again, it was a massive, massive undertaking. So everything, Larry would say, everything I know about Oracle is not from Oracle systems, but on Yahoo Finance. So, okay? Now, I am sure that none of that is happening for you all. However, the interesting thing was, I think Larry thought when he hired me, we were going to do an IT project. We were going to do an IT transformation. What became very, very clear to me right away was, in fact, that we were doing a business transformation, that we were simplifying our processes, that we were going to be truly global, which is we were going to get from point A to point B this way, not this complicated process we'd used for decades, multiple different ways. But you see, the important thing, though, and we did it all in 1 year. We brought the entire company together into one system, but we did it by simplifying our processes. But in those days, we were about $9 billion in revenue. My first year at Oracle, we saved $1.2 billion. Now, you would think that that's the important number in a story like this. But actually it isn't. The real important number is that year when I came, we were spending $650 million a year on R&D. But R&D was the single most important thing we did, which was to build better products for our customers. Now, we spend over $7 billion. And because of that, because of how we've spent and built our platform over all these years, we could finally come to something Larry talked to me about over 20 years ago, even then, which is to bring healthcare truly into the 21st century, to be able to really benefit not only from better accounting and better HCM and better supply chain, absolutely, and more secure database and economies of scale of the cloud, but to finally bring healthcare and all this technology to finally help our medical professionals save lives. And that's really what the journey has always been about. And you can, I'm sure, look up on YouTube Larry giving a talk many years ago, and you will see him say that if he gets hit by a bus at the Stanford shopping mall, and he can't speak, he's completely knocked out, and they go through his pockets, the only thing they'll know about him, since he doesn't necessarily go to that hospital, is that he's got a charge card and can pay for his visit. And that issue, that problem, has been in his head for decades. And seeing all of you and our announcement today and many more announcements to come, you're going to see this entirely play it out, because we were founded in 1977 as a project, a data project of the Central Intelligence Agency. So you can imagine how security conscious and paranoid we are. And we started way back then thinking about data. And we're finally, with the merger with Cerner and Oracle Health, we are finally bringing it to the single most important thing we can do, and we can do together, is save lives.
Okay, but Safra, bring us back, because I remember when I was in government and we were dealing with the chaos of the COVID pandemic, and we get a call, hey, private sector's calling, Oracle's calling, and they want to help. And tell us about what you did during that time, and then what was sort of the impetus or the turning point to actually thought about healthcare way, way back in the day, but then what was the impetus of actually doing the Cerner acquisition? What drove you to that?
So, of course, all of us, I mean, COVID hit us so hard, hit everyone, hit the whole planet so hard. But for us, coming from the data world, we found it so profoundly disturbing that no one knew anything. And when I say no one knew anything, it's not only that we didn't know what it was or how to cure it or whether we had to leave our mail out in the driveway for 3 days before we opened it or any of that, okay? No, the fact that we didn't even know how many beds were available, which medications. Remember, our poor doctors were experimenting. We were all desperate for different things. But doctors couldn't even share information amongst themselves. This is working. This is not working. Let's not recreate the wheel in every emergency room. And yet, we thought to ourselves, you know what? We already have a cloud. We immediately, with the pharmaceutical companies, all of the clinical trials didn't go at their sites, went right onto our cloud, by the way. Had we not had a cloud, we probably wouldn't have had vaccines so fast, okay? Because you know how long those take. We recruited people into the clinical trials. We built systems that kept track of the different medications that doctors were trying. We did things to help with the supply chain, to be able to find all the different parts. And what we did, by the way, Larry personally ran all those technical projects. But not only that, we realized we had the technology by then. We had the cloud, we had autonomous database, we had the development tools, we had the analytic tools. We built the applications, and we didn't try to sell it to the United States government. We gave it to the United States government.
Free?
And let me just say, I don't think anyone had ever given them anything, because they couldn't even find.
We didn't know what to do.
Seema finally solved it for us on having an agreement where, here, it's free, save America, you know, and we did. Thank you.